But for tonight, I'd like to introduce the Associate Director of the Center and my colleague, Ellen Hernandez, who will serve as the chair of tonight's meeting, and also will introduce the participants. Professor Hernandez.
Thank you, Jack. I hope everybody can hear me. We're a small, intimate group tonight, so it shouldn't be too hard for me to project my voice to you. This series so far has proved to be very informative and engaging, and I have no doubt that tonight will be the same. Our central question that we're asking is, who am I? This question of identity, and how do I determine who I am? And in thinking about that, I was thinking about something that somebody said recently, which is that, how do you know who you are? How do you first identify what your gender is? And what if what you knew to be true about yourself didn't match what you saw in your body? What would you do about that? How would that feel? And so tonight, what we're going to talk about is that experience of being transgender or gender nonconforming, and what barriers and discrimination people face when that is the case. And also, we'll be talking about some of the joys and the positive experiences. So I'm not going to go through an extensive biography of each of our panelists, but rather let them introduce themselves. And I do, though, want to talk about the context of how important this topic is. When we look at statistics, for instance, from the Human Rights Campaign survey of more than 10,000 LGBT youth, ages 13 to 17, we see that 40% of LGBT youth say that the community they live in is not accepting of them. LGBT youth are twice as likely as their peers to have been physically assaulted, shoved, or kicked at school. 92% of them say that they hear negative messages about being lesbian, gay, bisexual, or trans. And the top sources of anxiety and those negative messages are the school, the internet, and their peers. We have a disturbing and alarming rate of suicide attempts among LGBT youth. More than 30% report at least one suicide attempt within the last year. And for trans youth, the number is even higher. So this is an important topic for us to discuss tonight. And with me tonight, I have Genny Beemyn from the University of Massachusetts at Amherst. I have Tom Delgiorno from our own Camden County College, and Danna Bodenheimer from Walnut Psychotherapy Center in Philadelphia. Please welcome them. And I'd like to begin tonight by having each of them talk to you about their own personal experience with the topic and present to you what they'd like you to know as we begin.
I'll start.
Yes.
So I'm Genny. I identify as genderqueer, which for me means that I identify as more female than male if you were to create a spectrum. And I have identified as genderqueer pretty much since the term was created in the mid to late 1990s. So not a long history there. In fact, when I first started identifying that way, I did not know anyone else who identified that way, nor was I able to find much in the way of support. Because back in those days, which again is pretty contemporary, there was really only two ways to be trans. You were either TS, transsexual, or CD, a cross-dresser, with the distinction being made that if you had immediate plans for surgery, then you were put in the TS camp. Otherwise, you were put into the CD camp. So when I was part of a trans support group of individuals, mostly trans women, some female presenting cross-dressers who were about 10 to 20, some 30 years older than myself at the time, they didn't get me because I didn't fit their sort of their own gender binary of what it meant to be trans. Because for them, growing up, if you were trans, it meant that you were going to transition oftentimes. And so they couldn't get this person who identifies more female than male, but had no intentions to transition, or at least not fully transition. So it was very odd for a while. When I was out, I had more acceptance from cisgender, from non-transgender coworkers who wanted to be supportive of me and recognize the name I used and respecting my pronouns than I did from these other trans people who would sir and he, me, and so didn't see me as one of them. Saw me as simply, oh, you're a good ally. It took some convincing, really, for them to recognize that no, I am one of you. And I think going through this electrolysis, nothing beats a shared bonding experience of pain. So I think that was what really convinced them, like, oh, you really are one of us. And I changed my name, and so, oh, you really are. You're like, yeah, hello. And for fairness, it was not any different than the rest of society, right? That this was something, you are, to the extent that trans was on anyone's radar screen, it was someone who was, identified as the opposite gender, right? It was very much a binary. You're either this or you're that, and so there wasn't a cultural space for that. And it's so different today. It's just such amazing where we look at college campuses and non-binary folks are the majority. So it's really gone from being invisible, and it's still largely invisible. But you look at when I do large lectures, I will ask the audience oftentimes, can you name someone who is in popular culture who identifies as gender non-binary? And almost no one can think of anyone. I guess there's now one person on one TV show, a character, and the person identifies as non-binary, but that's pretty much it. So there isn't the role models out there, there isn't the imagery out there. But still, there's much more visibility on college campuses for non-binary folks than there ever has been, and it keeps growing as more people come out as non-binary. I was a trans activist even before I began to identify as being trans. As a grad student, I worked to get our university to add gender identity expression to our non-discrimination policy. This was in 1996. And we didn't know at the time, but we were the very first college in the country to add that to a non-discrimination policy. And probably the first college in the country to have any trans supportive policy. Pretty great. But of course our university did not know that at the time, else they would never have gone along with that, like, no, we're not gonna be the first. So that really got me interested in trying to do some of this work. I was for a number of years in the early 2000s was a director of the LGBT Center at Ohio State, and seeing more trans students coming out and getting baffled looks, like no one understood what their experiences were, no one knew how to support them. So I decided, this is going to be something I'm going to try to address. So I started doing some writing on the needs of trans students and what colleges need to be doing. Did really many of the first articles that were written on the topic. And that was 15 years ago now. And I got to say, I still have to do that same sort of education, doing I do webinars all the time, I do conference presentations, go to universities. I'm saying the same things now I was saying 15 years ago. Things aren't changing that quickly, sadly. There's been some change. There are some campuses certainly that are trying to support their trans students and doing a fairly decent job, but there's no college in the country that does a good job because our institutions were built on a gender binary. They weren't built with trans people in mind. And trying to undo all that is a really tough chore, and some of it goes beyond campus, of course, obviously goes to society. But no college is really a safe, comfortable space for trans people today. So I continue to talk about it ad infinitum because people still aren't listening, making the changes that need to happen to be supportive of trans people. Now I do more work around research because I've gotten just tired of saying the same things over again about, gender-inclusive bathrooms and not misgendering people and all that. So I started really doing more research and have a book that's coming out next year. It's a anthology called very creative here, Trans People in Higher Education. Really the first book that's really going to look at a wide range of different trans identities in college, faculty, staff, and students as well. So that combining also research and personal narratives, that's going to be really, really, really powerful. As part of that work, I did what, as far as I know, is the first national study of non-binary trans college students. As I mentioned, what we're seeing today is non-binary trans students and also non-binary sexuality students are the majority on our college campuses in terms of people who identify as other than cis, as other than heterosexual, but no one's talking about that. No one's studying these. This is who our students are, but we're back in the days when most of our students identified as being lesbian or gay, or being what was then called transsexual, now called trans women, trans men. Certainly there are those folks on campuses, but those are minority within the LGBTQ plus. And I use plus because they could go on for titles, but that's who our students are today. But our faculty, our staff are, to the extent they know anything, are a generation behind in terms of what they know, who they think their students are in the queer community. So trying to get people caught up to speed about who our students are today and what their experiences are has been a big part of what I'm doing these days.
Thank you so much. That is, that's a fascinating perspective that I actually don't know that I was aware of, and I'm sure there are people in the room who might not have been aware of it either. And so thank you for sharing that. And Tom, if you could tell about your experience.
Sure. My first exposure, and I hate to use that word, it was as a physician in 1978 when I first got into practice. Before my office was getting built, a physician in the area had a heart attack, and his wife approached me to cover his practice for 6 months until he returned to practice. So when I would go into the patient's room, I didn't know the patient, and I would read the chart before I went in, and I saw this one woman who was getting, it said IM estrogen, intramuscular estrogen every month. So I was flipping through the chart looking for when she had her ovaries removed, when she had her hysterectomy done. So I walked in and I said who I was, and I said, when did you have your hysterectomy? She said, oh no, honey. Back then it was transsexual. I said, well, I had no idea, obviously. So I continued on her treatment, which was minimalist at that time. All the treatments was intramuscular estrogen tablets, which were deadly, and the spironolactone, which inhibits some of the male hormone from the adrenal gland. So the more I got to know, her name is Donna. The more I got to know her, the more comfortable I found myself around her, and I said, there's something to this. I mean, this is not the freak show that we were led to believe. So I said, if I'm going to do this, I want to do it correctly. So I did a literature search, which was excruciating back then, because there was no Google. You had to bury yourself in the library. So I went up to the physician's library at Penn, and it took me 3 or 4 long days to uncover 8 articles on the treatment of transsexuals. There was a couple from Europe, a couple from this country, really not a whole lot of literature. It mainly dealt with hormones, estrogen mainly, and spironolactone, and the use of oral agents. The more I read about the oral agents, then I realized I had to go through the liver, and you could have the problem with hepatomas, so that was problematic. So the more I got into it, the more I decided I wanted to, really get good at this. So when I was finished my 6 months at this other physician's office, I told Donna that, I was leaving and I was going to open up my own practice. So she said, well, I think I want to come down and, be your patient. So when she came, it was such a small community that with her was 8 or 10 other girls. So my practice flourished because of that. So I became a de novo, a de facto expert in the whole thing. And my practice over 30 years encompassed about 60 transgender women. I had no trans men, 60 transgender women. And I got a little pushback. I got a lot of pushback from my colleagues because you have to remember now, this is 1978. This is really the dark ages. We were talking about this at dinner. The only path builders at that time was Christine Jorgensen. We had Harlow in Philadelphia, and really not many more. Fortunately, Harlow was a very attractive woman, and she gave a lot of credence to the physicality of trans women. So I got a lot of pushback from my medical colleagues, and they said, what are you doing treating? I said, listen, you don't know until you hang out with these people what you're talking about. I said, if you were looking in the mirror, and they were male colleagues, if you look in the mirror and you grow breasts, what are you? You're still a man because you're a man up here. Suppose you grow a vagina. Suppose your penis falls off. What are you? You're still a man because you're a man up here. So as Allen Iverson said when he was a basketball player, he said, we're talking about practice. We're talking about tissue. We're talking about tissue. It's not what makes you who you are, tissue. It's who you think you are. It's who you believe you are inside. And you can't manipulate that with any kind of medical concoction or any kind of hormonal treatment. So the more I became comfortable with this, the more my practice blossomed. One of the girls, she was 16 when she came to me, and her parents had tossed her out. So she met a guy and she got married, and she wanted me to give her away. So I took my staff up to Scranton, which is where she was from, and I gave her away. And now she's coming down the aisle, and I said her name was Paige. I said, Paige, you look so happy today. I said, congratulations. She said, well, if you had one wish and you got it, wouldn't you be happy too? Which was a nice sentiment. I'm delighted, I'm gratified, I was happy to have included 50 or 60 of these women in my practice because they are the evolved of the species. They were my happiest patients. My staff looked forward to their visits. They were never down. There was one that was down one time. If we have time, I'll tell you the story at the end. It's a little off color, but this is the group for it. But it was a perfect experience, I only wish that all my colleagues, all my physician friends could have experienced what I did in dealing with these girls.
Thank you so much,
You're
Tom,
welcome.
and thank you for sharing that experience with us. And you might not know it, but I will share with you that Tom was the trainer for my first training as an ally at Camden County College many years ago, and introduced me to the ins and outs of becoming an ally for people that I had not had a lot of experience with, and getting to know what to do to support my students, and made all the difference in my teaching. So I'd like to also introduce you to Danna Bodenheimer, and she can tell you about her experience in Philadelphia.
Hi, I'm Danna Bodenheimer. I dwell more in the world of mental health than medicine or higher education, though I've done a fair amount of teaching. I was in private practice as a therapist for, like 8 or 9 years, and my waiting list, because I was known as a queer therapist in Philadelphia, was becoming increasingly unmanageable. I don't know how anybody knew I was queer. I don't know how the rumor gets started. But it was like every day I was getting a phone call, and didn't have many people I felt comfortable referring to, because I didn't know if my referral was going to be held in a way that was safe and honored the complexity of their identity. So I decided to open a group practice, and I was terrified to do that because it's scary to be a business owner. And I started with 5 clinicians, and every time the phone rang, this was 2 years ago, I was like, oh my God, the phone's ringing. You know, they got our phone number. And it's been only 2 years, and now there's 23 therapists, 400 clients in a waiting list of about 150. The goal of the practice was originally to pick up some of the slack from what is called the Gender Identity Clinic at CHOP. CHOP, it has one of the few gender identity clinics in the country, and what they basically do is facilitate youth through the process of transitioning in whatever way they can. The waiting list at CHOP is usually about 150, and those patients wait for as long as it takes for only 3 sessions, because that's all they're allowed to offer given the limited amount of resources. So Philadelphia being a fairly resourced city, I guess, I don't know if that's actually fair to say, but Philadelphia being a fairly diverse city with some infrastructure doesn't actually have a ton of support, and at the same time, it's one of the most evolved cities in terms of dealing with trans identity and queer identity. And even there, the problems in terms of a lack of resources are pretty substantial. So I basically spend all day working with clients who identify as LGBT or Q. And I think it's really important to highlight that there's a difference between those identities. We often just sort of say LGBTQ something, something, something. And I think that lends to a feeling of invisibility and texture that exists within the community. So to be lesbian or to be a trans woman are 2 completely different things. And there's something about the umbrella that can sort of erase the nuance of what it means to live within the queer community in your own idiosyncratic identity. One of the things I've learned as a clinician is that first and foremost, language matters, and language brings the self into a relationship. So if you're looked at and not understood through the proper name or proper pronoun, then you're not really there. Your self is erased. So a good part of what we do in our practice is literally ask our clients when they call, what's your name? Is that the name that appears on your driver's license or insurance card? A lot of times it isn't. So we talk about how to honor their name and not to use the name that they were given at birth. We don't ask what's your preferred pronoun, we say what's your pronoun. To say preferred pronoun suggests that this is optional. We're no longer dealing with something that's optional. This is mandatory in order to understand who somebody is. Every single choice we make around language matters. When our clients come in for a letter, which is a big part of what we do, we're a mental health practice, which means we play the unfortunate role of gatekeeping before somebody can transition medically. We just give the letter. We don't ask them to prove anything about themselves. We don't make them go through 6 months of treatment. We don't think we know more about their identity than they know. But we will not call it gender reassignment surgery. We call it gender affirmation. Because we're affirming who they are, we're not reassigning who they are. We ask people how they identify and what language they use, and then we defer to their answer and use that in a way that's as precise as possible according to what they've said. So we call, for the most part, members of the trans community trans. We don't say transgender. Trans is a term that captures the complexity of many different things. When we say transgender, we are then narrowing people who fall under the trans heading out of the community. We're marginalizing them. So there are people who are genderqueer who might not identify as transgender. These are all different words with different meanings. And one of the things we start with when we work with somebody is to ask them to explain, not to educate, but to explain to us what language would feel most precise to them. And that in and of itself can be very reparative. When Genny was talking about how there's no institution of higher learning that's built for the trans community, I would argue that there's no institutions at all. Beyond higher learning, there's literally no institutions that exist to support the trans community. So I had a client the other day who works for the local energy company, got injured on the job pretty severely, and went to the emergency room and was waiting with their supervisor, because the supervisor had to make sure all the workman's comp stuff. And they ultimately just decided to leave because they felt too self-conscious going to the restroom in front of their supervisor and identifying so they never feel safe going to the restroom, basically. And they were like, if I have to make this choice in front of my supervisor, I'm going to get flack for it at work. And then didn't get the services they needed at the emergency room because it felt safer to go home and pee than to use a restroom in front of the supervisor. So it's like there's no hospital, there's no city hall, there's no institution of higher learning, there's no elementary education, there's nothing built for the trans life. And when I even started our practice, we started having a male and female bathroom because that's what the building had. And I was like, well, it's the cheapest rent. And then I realized that we weren't really doing anything for our clients at all if we couldn't even find one room for them to use to take care of their bodies in a way that felt safe and healthy. So I think that the primary thing I just want to state is that mental health sort of rests upon our ability to see the person who's sitting with us clearly and according to their self-definition. I had a friend the other day ask me how to explain to her 3-year-old that one of their teachers at school is genderqueer. How do I get my 3-year-old to stop saying he or she about this teacher? And I basically introduced them to the idea that parents are making a guess as to what their children's gender is at all times, basically based on an ultrasound, right? Before the child's even born, that guess is made. And that the parents are doing their best according to a private part on a child's body, and that those parents can be wrong, and actually are wrong many times. And that it's our goal as students, as friends, or whatever, as therapists, as teachers, to understand that the parent who made the decision and assigned a gender at birth can be corrected, and that we can all survive that intact. So that all our gender is, when it's assigned to us at birth, is a guess. It's an estimate. And we have to be open to the possibility that over time, that estimate was a mistake. And let the person define that themselves. I think that the last thing that I just want to say, and then I'm happy to answer questions with everybody else, is that there is a very big difference between gender and sexuality. We often talk about them in ways that are conflated. I've come to realize over time that people are asked to define their sexuality before they have a real understanding of their gender. It's like we can't really understand our gender until we're free enough of social messaging, which requires a certain amount of maturation to occur. So I have many clients who have identified as gay or identified as lesbian, and then they realize that actually it's that they're trans, and they don't know what their sexuality is yet. Because it isn't until you have a solid understanding of your gender that a real understanding of your sexuality can occur. And I think one of the things I'm seeing really thematically is a re-coming out process for so many clients around their sexuality. And what I'm encouraging younger folks to do is to not foreclose on any idea about what their sexuality is until they have a clear sense of what their gender is and what their relationship to their body is, and to sort of help them slow down the whole process, which is a really difficult thing to do when Target tells you what aisle to go to, before you're even born. So those are just some preliminary thoughts, but I'm also happy to answer any questions.
Well, thank you.
Of course.
Those are some wonderful insights, some of them brand new ways of looking at things for me, and I really appreciate that.
Sure.
And I do have come to understand only recently that we use the abbreviation LGBT, LGBTQ, I've seen LGB plus T, to kind of separate things out, and we lump together groups of people who don't actually have the same needs and the same issues. And yet, I also recognize that there is some intersection of needs and issues, and perhaps something to be gained by putting everybody in one group. Maybe, but what do I know? So but that's my thinking on it right now. So you've all touched on my first question in different ways, but I would like to bring it back to focusing on barriers. I'm hearing you all talking about this, but what can we identify? What are the barriers that you see that trans people are facing medically, socially, in educational institutions, that those of us in the audience who are allies should be aware of? Anyone can take this question. You can all take turns.
I guess I would say three things. One is a financial barrier of getting access for those who are transitioning, getting access to hormones and gender-affirming surgeries, and for younger people, getting access to hormone blockers so they don't have to go through the wrong puberty for them and have to then later on try to reverse things. So that's a real obstacle. Most colleges, the vast majority of colleges, do not cover hormones and surgeries as part of their student health insurance. So that's a real obstacle for people being able to transition. I think another barrier that I see in my work, which is primarily with students, is how often I hear from our students that they have to educate their provider, that the provider knows nothing about working with trans people, whether it's a therapist or a physician, having to do basic work that they're not there for that, right? They're there for getting therapy. They're there for treating whatever is going on with them medically, and they're having to educate them about name and pronouns and a whole host of other things about how they might refer to their body differently than someone else might, because they don't look at their body parts the same way as someone who's cisgender might. So that's a real issue, and that gets back to the whole issue of also misgendering. I can't tell you, as someone who's non-binary, the feeling of invalidation you experience when you go to a medical provider and have to fill out a form and it says sex, M or F. You feel just so erased, like, what am I doing here? They don't get that I exist, nor do they care that I exist. So if I'm not getting the right respect, even filling out a damn form, how am I going to get respect from the doctor or whomever I'm going to see behind the waiting area? So that's I hear from so many non-binary people just the way that providers make gender assumptions. Look at you, put you into an M or F box, and then use the wrong pronouns for people. And that just, you've lost someone right there. If you're trying to get help, get support, get treatment, you've already lost that person and their willingness to really want to work with that provider.
Thank you. Does anybody else want to field that?
As far as the surgery goes, back in the day, it was in this country it was about $30,000 to $40,000 for gender affirmation surgery. A lot of the girls would go to either Brussels or Montreal. It was cheaper to fly there, get the surgery there, stay a week, post-surgical, and then fly back. And it was still cheaper than having it here. Now, I've been out of the loop for about 10 years, but I don't know what it is now. But back then, that was the finances of it. And the work done overseas was very, very good. I mean, those guys were, especially this guy named Jagers, Dr. Jagers in Brussels. He was an artist. There was Dr. Boudin up in Montreal, whose work was artistic, very, very good. There was a guy here in the States way back when, Dr. Stanley Biber. He bought a shuttered-up hospital in Trinidad, Colorado, and he would do 3 or 4 trans surgeries per day. And he had a long, long career because obviously he was one of the few at the time that was doing it. And his work wasn't too bad. There was I'll be kind. There was a doctor in Philadelphia, Dr. Malloy, who was a urologist and attempted surgery way back in the day. Fortunately, he doesn't do it anymore. But In Philadelphia, we're lucky now. We have Sherman Lease. We have Christina McGinn, who are very good people.
Thank you, Tom.
The question is about barriers,
Yeah,
just generally barriers.
yes.
Okay. So I would echo what Jenny said in terms of access to medical care. I actually feel like access to anything that supports one's gender identity can be really challenging. Affording a binder as one's breasts grow, that's expensive, and the cheaper binders aren't really that comfortable or breathable. Basically, anything you buy to support transitioning is pricey and out of reach socioeconomically. I also think that that barrier gets compounded by the fact that it's hard to get a job. It's really hard to get a job when your name on your resume gives somebody the impression that you're going to show up as a cis woman, and then you show up as a trans woman, or you show up as a trans man, and then you face the disappointment of the person who's interviewing you and subsequently don't get the job. So finances are always a struggle. Getting a job makes that much harder. And then also, almost every homeless shelter can be very gendered. So the poverty is really, there's no safe remedy for the impoverishment of the trans community. And one of the other issues in terms of access and barriers for the trans community is any domestic violence situation. Most domestic violence shelters are highly, highly gendered. They're for women, and they're usually for cis women. So for a trans body in danger, there's not much available in terms of services.
Yeah, and speaking about gendered spaces, I've been thinking about it a lot lately in terms of what we saw not too many decades ago with separate restaurants, separate fountains, and all of that. And when we talk about gendered shared spaces, like bathrooms, like locker rooms, like shelters, we're talking about doing that same thing. And we always have good excuses, right, for why someone would be uncomfortable with someone else being in that shared space. But you know, when we had separate areas of the bus and all of that, there were also rationales that were the standard pat explanation for why it would be that way. But we know and accept that that wasn't right, and the same should be true now.
Right, and the excuses are also based on heteronormativity. It's suggesting that women should shower with women and men should shower with men because there's no possibility that there would be attraction there. So the levels of erasure based on how things are gendered are quite layered.
Thank you. So do you, any of you, see that there are certain, that there is, we obviously know that there's discrimination. Is there discrimination that is unique, the way you see it, to trans and non-binary people as opposed to the LGBT?
So I think that there are a few ways that harassment plays out differently, you know, in terms of asking invasive questions about someone's body. That's a unique thing to trans individuals. Misgendering, you know, some gender nonconforming people obviously are not trans, but being misgendered is a very common experience of trans individuals, and people not respecting the name and pronouns that a trans person uses for themselves. That's a form of harassment. If you're using the wrong pronouns for me deliberately, and I've told you no, I go by they, them, you're harassing me. And that's an issue that is unique to trans individuals. And I'm thank you for saying about, you know, the preferred. I've been saying for years and years that, and I still see trans people themselves saying preferred pronouns. It's like you are doing yourself a disservice by saying that language. And also access to facilities, which again works for, I should say works, but is also an issue for gender nonconforming people, but for so many trans people, access to facilities to keep with how they identify is a huge issue of violence, of harassment that is unique to our community, or largely unique to our community.
I mean, I feel like, to answer your question really bluntly, I think that trans people are hated. And I think they're hated in a pretty compulsive way in our country. The rate of murder for trans women of color is absolutely alarming and often ignored. Trans bodies aren't even really properly dealt with in morgues because they get misgendered even in death. So I feel like the extent of the hatred towards the trans body and the trans person is really unending, and I don't think it's surprising at all, not to be political, but to be political, Trump would tweet that trans folks should not be allowed in the military when he was needing to distract from his own misconduct, because it's a catch-all. It's something that, it's like a moth to a flame. People in our country are compulsively binary. We are constantly policing gender performances, and when we see somebody add any nuance to that performance, we hate them. And it's largely projection about our own discomfort, about the complexity of our own gender. But trans folks are like scapegoated for our own dis-ease with our gender identities as a whole.
You think it's a generational thing? You think it's different age groups have more dislike or hatred, as you put it?
No.
Even young kids?
I think young kids really, really police gender.
Well, I think it depends on how you parse that. I was talking over dinner about a Gallup poll that was done earlier this year asking about access to bathrooms, whether it should be based upon gender identity or sex assigned at birth. And there's clear age differentiations that basically the older you are, the less accepting you are of trans people having access to the way they identify themselves. And so the youngest demographic, millennials, especially the college-age millennials, overwhelmingly support trans people having access to facilities. And if you break it down by male, female, the argument gets made oftentimes that, we have to have the sex assignment because we don't want to have men going, quote unquote men going into women's bathrooms and saying that they're really trans, when in fact that poll showed that women, by a significant margin, were okay with trans people using bathrooms that correspond with how they identify. It was men that were having the issue with it. So it's, again, one of those examples of men thinking they know what's best for women. So I think that there is some ways, but yes, young people, you look at elementary schools, it's highly gendered.
Yeah, I mean, my 6-year-old son, he wears girls' clothes a lot. I don't know why yet. I don't totally get it. I'm sure I'll find out. And the kids just freak out. They're like, what are you doing? Why is there rhinestones on your jeans? And it's like the policing happens maybe not in bathrooms and not in as like complex a way as it happens in adulthood, but my God, it happens. Mm-hmm. And to me, it's totally permeates everything.